Good afternoon. My name is Jason Pleitez. I am a graduate student in the public administration program here at Kean University. And my research is focused on the Supplemental Nutrition Assistance Program, better known as SNAP, and its inequities amongst Hispanic beneficiaries. A little introduction about SNAP and the purpose of SNAP. We know that 1 in 8 Americans receive federal assistance through the Supplemental Nutrition Assistance Program. And for a program this size, for it to service millions of Americans, it's important and critical to regularly assess its efficiency as well as creating laws that will improve its management as it is a constant change. The federal government constantly updates the SNAP program to directly address events and circumstances that may be occurring in the U.S. at any given time, enhancing food insecurity, and expanding low-income people's access to a nutritious diet are the main objectives of the SNAP program. We see that over 10% of Americans face food insecurity in most years, despite the availability of SNAP as well as other safety net programs provided. But we see that moreover, families with children, as well as Black, Hispanic, and Native American communities are more likely to experience food insecurity and financial hardship. To address this, the program gives recipients more purchasing power, meaning they are able to purchase the foods that they want with the limited amount of money that they get per month. The goal is to encourage the recipients to cook and prepare their meals while promoting healthy eating. We look at a specific study which determined that Latino households' participation in the largest safety net program, which is SNAP in the United States, was correlated with county and state level immigrant criminalizing and integrating policies. And with this survey, they saw that even in cases where they were unrelated to SNAP eligibility, so other programs that would assist them, housing opportunities, whatever the case may be, local and state immigration laws may have an impact on Latino households' usage of SNAP. And to boost SNAP membership among Latino households, jurisdictions with less integrating policies or those with more criminalizing laws had to think about policies, new policies, and implementing focused outreach initiatives. We see that these policies that criminalize and integrate immigrants, even though they have no direct bearing on program eligibility, it is linked to Latino households' enrollment in public assistance programs as a whole in the United States. With findings, sanctuary policies that can be implemented at the state, county, or sub-county levels, as well as state-level immigration laws that do indeed have an impact on Latino enrollment with the Supplemental Nutrition Assistance Program. Our results conclude that the benefits are based on unemployment or underemployment, requiring recipients to report their hours worked each week to continue to receive benefits. And rules like this that are in place do not consider the realities of work today, nor take into account the systemic racism against people of color in the U.S. As people of color face greater incarceration rates due to unfair criminalization, employment discrimination, racial income disparities, they are also being more likely to live in neighborhoods with poor access to jobs. These neighborhoods don't have adequate access to grocery stores with nutritional foods that will nourish the bodies of not only those adults, but the children as well. Due to these long-standing systemic barriers, people of color experience higher underemployment and unemployment rates than white Americans, and thus they are unequally targeted by these rules which pertain to the Supplemental Nutrition Assistance Program. According to the Center for Anti-Racist Research, Black and Latino families are more likely to experience food insecurity, but data shows that the highest number of recipients that benefit and are on the Supplemental Nutrition Assistance Program are white. Adults subject to SNAP time limit are poor and diverse, as we see in the table and in the graph on the research poster. And we're able to see that it is diverse considering a variety number of metrics. In conclusion, we have 3 main points concluding this research. While the program has put food on the table for millions of families, equity remains a constant issue, specifically those people who are of color. Healthy, balanced diets and product eligibility are determined by food and diets that are Eurocentric. Many traditional foods, cultural appropriate foods for communities of color, therefore are either ineligible or even stigmatized as being quote unquote unhealthy. Eurocentric foods may not always be healthier than those that are not. An administrator should carefully consider how to accurately reflect the average cost of food, spice, herbs with the USDA's Food and Nutrition Services as they reevaluate the next cycle of the SNAP food plan. We also determined that out of all race groups that participate in the SNAP program, Black and Latino families are the most impacted by inequity. These policies placed by federal government leaders, political leaders, they place a limit on what these families can buy and what they're able to purchase with the money given to them. We recommend that policies and procedures are put in place that adequately represent the cost of living, the cost of food prices, as everything has been changing even in the most recent years after the COVID-19 pandemic. While the SNAP program provides foods for those who participate, it is also difficult for recipients to choose and live a healthy lifestyle. As we looked at foods, as we discussed earlier with Eurocentric foods, foods from certain communities, these families are not able to purchase those foods as they are not included in the food plan provided by SNAP. To characterize discrepancies, they assessed the socio-demographic adjusted mean purchases of 4 nutrients and 7 unhealthy food and beverage groups, such as junk food and beverages with added sugar, among white, Black, and Hispanic SNAP participating and non-participating households. And in this study, we realized that the adjusted mean household purchase of processed meat, sweeteners, sugar, sweet beverages, energy show significant Black-white disparities. Inequities, of course, favoring white families among non-participants. Thank you.